Okay, Famulem, we are live, and then we thank God for that. This na Psycho John Barry. They come to una live from the United Kingdom, and as una be the see the flyer, we get two very important personality today who the interview with these people. They are medical people, so we don't deal. They talk about politics, talk about other issues, but at least we need this platform. They always diversify. We dey talk on all issues. So today we get them people here. We dey bring them to una as anytime for introduce themselves and for make them can tell una wetin dem dey do, wetin dem work, wetin dem dey do and wetin dem don do for country Sierra Leone. So stay tuned, stay connected. This na the Then and Now Media Empire. They come to una. So una again, una not forget for share to as many people as una come. This is Psycho John Barry, the canto una. Stay tuned. Okay, una welcome back, Fambulem. Again, I just want to remind una share the links to as many people as una can. So, as I've been done tell una earlier on, today I get Professor Charles Senesi and the president of the Afro-European Medical and Research Network. And then we get the vice president, winner Dr. Mohamed Kamara. So, but we go one fully the professor introduce himself more so that una know actually who that una they see in front of una. Over to you, Professor.
Well, thank you very much, colleague, and thank you very much for that. You get with this program together with my deputy advice, Dr. Kamara. As I say, I'm an associate professor, Dr. Charles Senesi, and then I'm a physician. And then I do series of postgraduates. I did a medical degree, and I did a master's in dermatology in the United Kingdom, a postgraduate diploma in epidemiology from the University of London, and I did a PhD in health sciences, focusing on international research in the United States, and concluding a second PhD in epidemiology, focusing on public health epidemiology, especially between the north and southern countries, as well as the south and southern countries. And then I'm head of the Afro-European Medical Research Network, where I network with the try for bring we skills them to the continents or countries of origin. And then we work closely with the World Health Organization in Geneva. We get membership in many countries in low and middle income countries, especially sub-Saharan Africa countries, and more so in Sierra Leone. And we are also United Nations accredited in Geneva, in Austria, and in New York. And we do a lot of knowledge transfer programs. So it's a pleasure for me to be here. I hope you are getting me clear. Thank you.
Okay, thank you so much, Professor Charles Senesi, the president of this wonderful organization. But we'll go back to Dr. Kamara himself. Please tell me a bit more about himself.
Thank you very much.
Okay, good. Yeah.
Mr. Psycho John Barry for having us here this evening. As Professor don't say rightly, myself now a medical doctor. I went to the same medical school as Professor, albeit we're about 22 or so more decades apart in terms of our training. But we also get a medical degree from Sierra Leone, and when I finished medical school, I did a bit of my internship in Sierra Leone as well. And I went on to work with Shoetran Memorial Hospital, where I did most of my work as a medical officer and subsequently posted to Koinadugu Government Hospital. During the course of the Ebola outbreak, fortunate for work with the World Health Organization, wherein I work as initially contact tracing mentor and then surveillance program officer. And then later on proceeded to the United Kingdom for do a master's in public health for development at the London School of Hygiene and tropical medicine. Then did my medical license exams in the UK, where I've been practicing for the last 5+ years. And currently, I'm a specialist in intensive care medicine, working at the University Hospital Birmingham, precisely Queen Elizabeth Hospitals Birmingham. And I happen to be the vice president of Aermn. As Professor don't say, he don't clearly illustrate written Aermn there about, so I'm not going to add much to that. But hopefully, as the conversation progresses, we will delve more into our activities and some of the things we don't embark on over the years.
Okay, thank you very much. Fambule Munadoyeri, of course, this now well, we no need for still educated people like, but Unadoyeri will fambul them. Then fambul them will like for me kuna tell we waiting this organization dey for, even though the professor touch this small, but one for make it go details and tells as fambul them, Sierra Leoneans them, waiting actually this organization dey for.
Yes, the Afro-European Medical and Research Network, not a medical research network, my medical and research network, now a non-governmental and not-for-profit organization. As I earlier on said, we get a special and a consultative status with the United Nations. We get a strong vision for improve the quality of life for people from low and middle income countries, irrespective of your race, your creed, your faith, and social affiliation. And we also serve as a research network. We are inactive individuals from health and all allied disciplines. Health, according to the 1948 definition, is a state of complete social and physical, and not only the absence of disease and infirmity. We look at that holistic view of healthcare, and then we give expertise to the continents or countries of origin. We get members in all the continents around the globe, and in almost every sub-Saharan African country. We will operate both in Anglophone and Francophone countries. And with greatest strength is that we build upon the collaboration, with people there, which means we don't reinvent the wheel. We're going to countries that go complement the effort of the healthcare delivery system. And we use technologies to do this online, but most importantly, organize conferences, organize symposia, and then we take the outcomes of this symposium onto the field in the form of mobile clinics. The Diaspora Medical Mission with mobile clinics, we don't do for the past 30 years or more, even while the medical school, which means we believe that people in the hard-to-reach areas get the right to access health. So where at the medical school and salon, we take the team from Freetown to different parts of the country. And now that are based at the West, I don't do 20 years now, Switzerland almost. So they take a team from Switzerland, from the UK, from the US, and we're in at different parts of the globe. So that of Africa.
Okay.
So that we go of 6 years in particular. So now that's what they do. We also encourage the young communities leave your comfort zone and go to the far away villages and help the people them with their healthcare delivery. We increase their health awareness and their health seeking behavior. Whilst at the same time, they complement the healthcare delivery system, i.e., the Ministry of Health. Now that's what we do now. Many African countries for the East, West, Central, Western Africa, Liberia, but more now in Sierra Leone over the past 7 years. With a big mobile clinic, big medical team with all these critical care specialists. We get the surgeons there, we get the gynecologists there, maybe the dermatologists as well. We get the specialists there with the laboratory sciences. So all they work together as a team for really bring health to these people in the far away reach, true to the sense of the universal health coverage, we leave no one behind. So basically, that's what we do over the couple of years.
Okay, thank you so much.
Maybe.
Thank you so much, Professor Senesi. And also, what been they do some bit of research about you? Well, I will get some information, say from your school days. You been get this vision for like for volunteer for help people them and the community. So what in exactly? I know say you will say this now like okay now for provide health, but like what in give you that zeal, what in give you that empathy for like say okay you know what these are my goals and objectives.
Well, there's always something that they push you into action, you know. And then, even though I lost someone in the family where I young, we make a decide for study medicine and help people them. But even as a young student, instead of doing holiday jobs, me with one of some of my lifelong friends like James Wallace Cabo in the Netherlands, we decided say, there's a lot more we could do during the holiday. So we decided for volunteer. We started as president. I was Kim. I was member of the Boy Scout movement. So we go volunteer at the old people's home to their Cheshire home, where the people that we pick where they're born with deformities, who never do things for themselves. So over weekends, over holidays, or they go there, we do build parks, do afforestation of the Orugu Bridge, all that trees that they were on the Orugu Bridge, and we help for the plants of another team of people there. So always believe so they give back to the community in different ways. And so when I enter medical school, medicine I'm calling, I decided say, well, what to go do, use the health now, get doctors and nurses to go to the villages and see how we increase the health awareness. So that will be our passion for now for a long time, for 30 years or more.
Okay, thank you so much, Professor Senesi. And exactly what you talk so what I read about your profile and that make I ask you that question based on what I get about you. So Dr. Kamara, tell me what inspire you for go into this field. Why you not go do law, you not go read or journalism or you not go do engineering?
Yeah, I think the they can always say birds of the same feather flock together. So I think Professor pretty much don't speak me your mind. Me, growing up, I was a very me have been somebody we always like for dinner host. In fact, my nickname have been man host. I've always like for I was a super introvert early in the days, but I will always take very keen interest in things that happen around me, and especially with animals. So I've been very to me that kind of person. If, for instance, any animal die around, maybe a frog or something of the sort, it trigger a whole sort of emotional drive inside me. So to a point, if I see like a frog really struggle around, I go, my sister can always tell me, say, you go see like I will take that frog, they try to eat am by your arm and see if we forget am to some kind of water, if I make it survive. So for me, instinctively, I knew that my calling was to see how best we're able for help people in need. And for me, one of the most important platform where I think we were able to do that one day, now for probably get into the health sector. It was never an easy road getting there, essentially because at one point, lot of pressures as a young man growing up, thinking about that law. I did my O levels and get the required grades, and I think get conversations with various mentors across the board and see, thinking that given the kind sort of passion you get for whatever you do, you think say medicine could be the right sort of calling for you. And I have no regret pursuing that one day. And as I say, having done and get some of the best quality training as Professor Self can attest to. For we always think say we get a sense of duty, not only to the communities that where we come out, but we get a sense of duty to the universe where we find ourselves for share these experiences and make a difference in the lives of people, irrespective of their socioeconomic status, irrespective of their creed, as Professor said. So one of the clear examples we make inside now the fact that I could clearly remember back during the Ebola outbreak when we all know the amount of devastation we cause in our communities across Sierra Leone. And I remember myself and a good number of other colleagues beginning to work with WHO, and we were working in some of the hardest hit areas in Sierra Leone. I could clearly remember I did a lot of work in Kumala, that was in Konadugu district. Later on, went to Kono, and then subsequently in Putloko. So I've always had this sort of knack for go out there in the communities and help people. So when I eventually bumped into Professor this in organization, I'm like, this now a perfect platform, a perfect vehicle, okay, for bringing to light this burning desire within we for bring health to the doorstep of people who would have otherwise never accessed it.
Okay,
So
Dr.
me and
Kama,
Professor get a
Dr.
conversation.
Kama,
It happened
Dr.
that we
Kama,
all
Dr.
we
Kama,
all same, yeah.
before you go further, I just want for us the term you because like not that for don't be my next questions, but I only happy again that you don't touch into that. Before you've been done join this organization before you go now go like in that Ebola team for help Sierra Leoneans or now after that event they una, you see professor and join the organization.
Yes. So Professor's name is a household name within the medical practice industry in Sierra Leone. And fortunately for me, we all, as with every other academic institution, you have certain socio-political enclaves where people find themselves in. It happened that we all come out from that same line of thinking. So now be a household name. So we some of us were aware of what he was doing then. But to answer your question directly, no, I was not a member of the organization at the time of the Ebola outbreak because then I was very junior doctor at the time. I was just about 2 years into my practice. So at the time of fend me footing. So at that point in time, no, I was not a member. But it happened that Ebola came and some of we and a host of other colleagues across the board volunteer our services and we worked with the WHO and of course we were paid, so I can't really say voluntary service per se. But the fact that we find ourselves in these hardest to reach communities and able for bring about meaningful change and subsequently bring we country to zero new cases and bring that outbreak to a standstill for me, that will be an eye opener for me to think say there is so much we can do. And when I get in touch finally with Professor, realize say Aermn are the perfect vehicle to channel that energy, channel that passion, and make a difference in the lives of our people.
Okay, thank you so much. Fambul them again. I just want to remind you, say, una the watch the then and now media empire, and this na Psycho John Barry. Now they bring this program to una this evening 10. I deal with Professor Charles Senesi, the president, and then I get the vice president, who is Dr. Mohammed Kamara. Professor, whose work una don undertake na Sierra Leone since the inception of this organization?
Thank you very much for the question. Since the inception of this organization, we do first medical clinics in 2013 in Kenema district, in Blama to be specific. We bring in professionals together with late colleague Dr. Khan, where we pass away during the Ebola. We go on mobile clinics at the villages. And then that was for the clinics there. But since 2006, we've done very active in already in Switzerland. And then we do a whole workshop on topical issue where they affect the continents of origin. HIV/AIDS, the health workforce, problems with the affect African countries. But in Sierra Leone, we bring in this result to the field in the form of the mobile clinics. And then we optimize the Ebola Council, we make we get for stop for a while. And then we bring in consultancies from WHO for strengthening the surgical disciplines. The way that Aermn initiative with the WHO Geneva. So they bring in a lot of teams then. But then 2017, we be able to count together with the International Organization for Migration, we get a big diaspora team na Koinadugu in Kabbalah. We bring a lot of specialists them for short term, 2 weeks, for 3 months, 6 months. It's a big project for Kabbalah. Where in the nurses, then the doctors, that they stay for work with the local colleagues them and train them, improve their knowledge and skills as well. And then after that, 2018, we go with the bigger team also na Kabbalah, do surgical operations and do health outreach in the whole of Kailam district. and they bring in lots of medical supplies. I mean, really do surgeries on like hernia and hydrocele, where the poor farmer, they're not able really for get enough money for go do that surgery. So we able at least give that opportunity. They will do the free surgery for relieve of the big hernia and hydrocele. It's not both in what they call them, you know, so that at least they could become more economically productive and go back at the farmlands and gain that respect from their family. We also 2019 we go again at Moyamba district, the whole of the Moyamba, we do similar work there. We donated lots of equipment to the hospital. We donated solar lamps with the help of the Japanese company for help their Uma, they wouldn't at the village, they nurse the way they deliver and then they not get light. So the way we use the solar lamps then. And then 2020 will not be able to come because of the corona. But despite that, we see the need for empower the healthcare delivery system, the nurses and the doctors. So we donate sanitizers and we get that money, we buy masks for at least for protect the little 500 or more doctors that we get together with the nurses. Then we go through the professional organization and really give them so that at least they can protect themselves against the coronavirus. So really we don't hit the healthcare professional to a very bad extent. And then 2021, we come back again with a bigger team. We're going to carry it. Kamakwe. We did it for a couple of weeks. We do all these surgeries, outreach clinics for every people. That we bring the eye specialists them for help. We do a lot of teaching. Dr. Kamara and I are a big fan of that, teaching the young doctors to exchange skills and knowledge with them, actively teaching them and mentoring them. And then 2022, we did both island and mainland, also doing similar work, donating huge equipment to the hospitals, bringing new theater sets to the hospital, and doing surgical operations and community outreach. Bring the school picking there, we get a big dental team. Where everywhere we go in the country, always out of the parts of the country, always out of name. So we always develop and leave a dental clinic behind, because dental facility is non-existent in many of the facilities where they go. Initially, I'll be shy away from her. Now, so no, we cannot shy away from this problem. So we begin the 4 dental clinic in Moyamba, where it don't grow to such a high level that one of the young nurses that will train, now the sponsor for go study dentist in Cyprus. As I talk, so they don't get a scholarship to one of the dentists that will be carried. So that's now the human capacity development we do for the country. So for that guy is going to become a dentist, come back to the country and serve, and we'll go to train more dentists. And then 2022 again back with them, born as I say, island and main. For the first of what we do an island, so we'll be able to fulfill that again. It's a very challenging going on the high seas. At times, petrol the left wing road in the middle of the high seas. But we don't land for down the seas. With petrol left wing now, we think about solar driven boats. We access the population for every situation with the land farmer. So that's what they do now. And they develop hospital facilities, healthcare delivery system for support and complement the Ministry of Health of Sierra Leone and any country they work in.
Okay, thank you so much, Dr. Professor Senesi. We really appreciate you again with Dr. Kamara. We really appreciate you now for the time who una don't take for come explain to Sierra Leoneans, because if una they do things there like this, una know at least una not engage. I don't know how una can engage the media, but I believe say it's very, very important for the Sierra Leoneans make we know say okay, beside politics and other things, we get Sierra Leoneans them we genuinely they seek the interest of the people, the ordinary people. Like what you wanna talk so for go like Kabbalah. I don't hear about that what you say una work the way una can go do them operations and do. But how una they select? Una can select say okay, would they go do would they go treat a particular sickness now a particular district, or una just they go no more anything una go meet in a hospital, or how the operation they go, how una they contact them ordinary people they will sick, what in the procedure una can follow?
Well, basically all over Africa we work will complement the efforts of the healthcare delivery system, i.e. the Ministries of Health, and complements the international agenda, the WHO and the United Nations. So for every country we go, including Sierra Leone, the Ministry of Health always will host. Now they will likely identify the area where there are gaps, like where they be carrying in one of the newest districts, where they be formed very, very difficult, a challenging. That is the area where we like to go. For tell those people that they say they matter. So the Ministry of Health they identify an area and then we're working with the local stakeholders there, the opinion leaders, the political leaders, of course, in the area, the chiefs, I mean, the other people, them, so they go able to guide me and the district medical officer, and they go able, because they know the terrain better. But we can always work with them, so they will show the furthest place them, and we will access we help them. And we'll get all cases them before we arrive, like,
Yeah, I think say the
we do
professor
in this time in Kenema, we just get a planning meeting with the. Hello?
Yeah. I
You
think
get
say
me?
you go on and off. Yeah, will they get you now?
Oh, sorry. Well, so we always
Yes.
go with an advanced team first for study the terrain, you know, for make sure say we the local people that are the lead we, you know,
Okay.
and
Thank you.
that we.
Yeah, go on. Your internet, I believe say it dey come on and off, on and off. But go on, sir. We dey listen.
Oh yeah, sorry, this I did na Africa.
I know.
Yeah, so this is it. We have the challenges, and the weather also. The weather is a big challenge as well. Yeah. But so basically, now that we can do, now they can able to select the cases them. Now they can able, I mean, everywhere we get the same problem. Everywhere in the salon, the same problem no more in terms of disease population. So wherever you are, we can take care of you with the specialists what we get. We are non-specific. Whoever we see, they screen them, they bring come forward, they treat them.
Okay, thank you so much. Dr. Kamara, like this organization, I know say you did it. Like, how many like Sierra Leoneans them they na this organization? When are Sierra Leonean doctors, especially living in the diaspora? What are the criteria for
So,
joining the organization?
okay. So we own organization a very simple, very straightforward. Our organization is led by passion. As I say, the organization came into being, was born out of the experience of Professor Senesi. That experience we in get, share that passion there within colleagues them, and they don't start this one from the Tennessee Medical School. And the organization has been in existence for more than 2+ decades now. So for we, the primary driver for be part of this, you just need to be that doctor. You don't necessarily need to be a Sierra Leonean. As we say, this is an Afro-European Medical and Research Network. We have membership across the board. You just need that person will get passion for go and make a meaningful difference in the lives of people who would have otherwise never accessed the sort of care we can provide. So we have membership across the board. We have Sierra Leoneans who are living in the States that are working with us. So we have doctors and non-doctors working with us. Because our organization is not just centered around health professionals. We have people who can also assist us with, for instance, doing logistical work. Certain people are good at resource mobilization. So it's a network of professionals from all walks of life, albeit centrally driven by health professionals, because now that they will deliver, now that are the end products we will give to the consumers down there. So we have gynecologists. I'm not able to name them individually because I will stay out till tomorrow morning, and obviously you get that time. We have gynecologists, we have general surgeons, we have ENT surgeons, we have critical care specialists, myself inclusive, dermatologists, like a professor, that is his background. We have hospitalists across the board from Australia, from Switzerland, from the United States. We have our colleagues who are non-Sierra Leoneans from Iraq. For instance, our dental team that has been working assiduously over the last few years is headed by an Iraqi, British. Um, so he's from Iraq. We have colleagues from Kenya. We have colleagues from Nigeria who've been working very hard in the ops and GAIN team. We have laboratory specialists who are based in the UK and across the world. And so we have people from all walks of life, Sierra Leoneans as well as non-Sierra Leoneans. The common theme will always now that passion, that drive for make a difference in the lives of people, no matter how small. And Professor mentioned one thing where I just want to talk about. So since I become a member of Aermn, for instance, following the lead of Professor, I have never been on any vacation, so to speak. Because for me, in as much as I can afford for Komoya, go to the Bahamas or go to Santorini and spend 10 days there and enjoy a good time, personally for me, I feel far much more fulfilled to take 10, 15 days of my annual leave, go to Banff district, go to Kaine district, go to Kailaun, okay, and touch the lives of them people. And they, for me gain personal satisfaction from that. And I have never seen Professor since I know him. I've never seen him take a picture from a boat in the Bahamas, even though he could afford any sort of lifestyle he want for live. So now that passion that we all share, we all share that passion for go out there and make a difference. And if you're not a Sierra Leonean doctor, nurse specialist, or what have you out there, and you are passionate about making a difference in the lives of the people, okay, without any due consideration for their political background, for their socioeconomic status, you are always welcome. We get an open hand where we extend to everybody. And as Professor say, we work in close collaboration with our host ministries and host doctors. Because at the end of the day, now we don't job for complement what then they do. We need to go for reinvent the wheel, but for work in a collaborative fashion with them and see how best we for assist them with the work where they already done the deliver and then community then they plus or minus Aermn. I think I will stop this so far.
Okay, thank you so much. Fambulem, I just want to remind una say, una the watch the then and now media empire. Today we get Professor Charles Senesi, and then we get also Dr. Mohammed Kamara. Then they talk about the organization. Una save doyeri, and then una doyeri the service we they were they deliver to people them na Sierra Leone. They know the target, say the rich people them, then they go na the provinces to the needy. So this, I mean, this na a very good thing, na a very good example wey dem fumble the ya don the set. We know say of course people dem don the way don dey do this thing. We get Sierra Leoneans, but there were the stories. You find this platform, we not dey here for talk about politics only. We dey here for project the image of Sierra Leone and Sierra Leoneans, especially people the way they do good for our country. Of course, we can expose back people the way they do bad. We can talk, say, okay, them people, yeah, when somebody not do right, we dey tell Nayan, say, this person not do right thing. So we not care who you are, your background, we dey invite all man at this platform. So na don yeri, wetin then gentlemen I don't talk. And Dr. Kama, I understand say una get for go salon very soon. Tell me about that trip.
Okay, yeah. So I think I will just start then. Professor go. I think Ingo nip on the board definitely. So yeah. So as part of we ongoing activities over the years, Professor don't mention missions in Kailaun, Kenema. We've done missions in Koinadugu. We've done in Moyamba and Kaina district and quite recently in Banff. So our next mission coming up is in Kenema district. I think Professor already mentioned something to that effect earlier. So as we speak, we get a team of international experts, our experts working in Sierra Leone, looking towards delivering a diaspora medical mission in Kenema district. The vast majority of the team will be arriving by the grace of God next Friday on the 22nd. Some of us will be coming a bit earlier as part of the advance party. Professor is already resident in Sierra Leone. He's been resident there for the last few months. I mean, they do some other very important jobs in addition to Aermn work. But I don't think he's interested to talk about that today. So yeah, we hope to replicate missions where we don't do over the years now. Then this thing day now Kenema, and our hope is we'll be getting to Kenema somewhere around the. I think Professor, is it on the 26th, sir? Professor.
Yeah, 26, yeah. 26th of September, yeah.
Yes. So we're hoping to arrive in Kenema on the 26th of September. Yes. And I think the mission will continue up until the
10th of October. 10th of October.
Yeah. Yes, 10th of sorry, the 10th of October. So we go from the 26th, sorry, to the 10th of October. Thank you very much. So
Okay.
in a similar vein, we,
Yeah. Go on.
yeah. So I was just going to say, yeah, sorry, I will wrap up in a bit. So in a similar vein, we primarily work in close partnership with the Ministry of Health and Sanitation, which is represented by the district medical officer, Kenema, as well as your own team of experts with the work, the surgeons, then the other doctors. We get colleagues again, where they join me from Bo and other places. So we modus operandi as an organization. We not go reinvent the wheel, as Professor say. We dey work with people who already get the expertise in that country, and we will come out from the international community, the join hands with them, and tell best to push the well body business of that community there. So we very much respect that we model there, because by so doing, we dey ensure say the ownership of the process is actually being taken by those where they provide healthcare service for these people on a day-to-day basis. We just account for complement whatever they not they do there. And at the same time, we do knowledge exchange with them, and we also learn. I mean, knowledge exchange in the sense we will pass on waiting we know, the little way we know, and we learn from them as well, where we will take back home, and then we strengthen that sort of network, wherein we dey build a platform wherein then constantly able to we go back to reach out to them, and so on and so forth. But Professor will pick up from there. I don't want to say everything so far.
Okay, yeah, Professor. Okay, before you pick up from there, I just want to know whether una don't identify an area. For example, we say, okay, now Kenema, we need for focus na Kenema because of this and that. So what in particularly una focus get for being a Kenema?
Well, the focus will be on the primary healthcare, first of all. Reaching out to those hard to reach communities in different towns and villages in the Kenema district. And then in addition to health awareness and increased health seeking behavior in the Kenema, we will based on Kenema Government Hospital and Pangoma Hospital, two teams then we go for base day. From there, we don't already make sure they don't select some cases that we get surgical problems, the hernia, hydrocele, some of the growth at the skin, etc. We call lumps and bumps. And the one that we get gynecological problem, the one that we get skin problem, internal medicine problems, the one that we get eye problems, they don't already identify them in advance, because we don't work with the district medical officers, Dr. Kamara say, with the medical superintendent, a whole to the surgeons there. They don't go to the villages, they're now using the peripheral health unit, the PHUs there.
Okay, I think say the internet na salon this. Okay.
So that would do with the focus on a wide range of cases, and of course, Dr. Kamara go mention and say we also hold a continuous medical education with the doctors talking on the issue of critical care medicine in Sierra Leone. What would they do at the capital city in Freetown, bring people from all over the country, young doctors there. We let Dr. Kamara go impart in knowledge in the area of critical care medicine, where very, very low in Sierra Leone. But still say it can be done as a Sierra Leone done in that specialty. And me go did it forget the keynote address and talk of all wide range of issues, including ethical aspects towards the patient. So not only Kenema go benefit from this, in Kenema as well, the teacher will continue with the nursing school at every opportunity, the nurses in the hospital in Pangoma. So with a wide range of things that they bring in, and what we left, we identify some of the gaps there within at the hospital, now the facilities there. If anything they were able to do, as we do over the years, send medical instruments, send medical supplies to their hospital there, because once we don't see the need, we go back for filling those needs to the best of our ability.
Okay, thank you so much. When I talk about a very important thing, like again for Gogi, for send medical equipment, them especially after we do identify gaps and other thing, and or like you talk about something like this workshop, like or something. So this is, I think, a very important as well for give their people and the training. So when an organization can really organize them in there for training like regularly for train we maybe nurses and doctors when I can do anything and they.
Yes, Dr. Kamago homing on that what they do, but this is something that they do all over Africa. Like for instance, Zambia, we did a training of the whole Ministry of Health on critical, on pandemic, flu, influenza illnesses, and then they do even salon self, we bring a lot of colleagues in surgical training. So it's a whole range of things what they do. And Dr. Kamara, a teacher by nature. As a medical in the medical area. So we all home in on them and he'll tell you more about
Yeah.
Okay,
Yeah.
Dr.
Yeah.
Kamara.
Yes, absolutely. So we all the good news is most of we in this organization we passion not only rest with delivering health services as well, because we personally feel say some of us have been very fortunate. We we don't get access to very good quality training. Professor is a globally recognized person in the healthcare practice industry. He's given lots of talks at the United Nations, other places. So he's a known entity in the sphere of health across the globe. And we serve the grow up small, we serve the follow instead. We don't fortunate forget the platform the way we get, but we get a vast majority of the colleagues them, do you understand? Either by virtue of the situation they find themselves and all, may not be fortunate enough to get that kind of access. And to we personally, there is no point in acquiring all this knowledge, become a professor, write books, do all that one day, if that knowledge not trickle down to the people we need them the most. So this is where our passion comes in. So we believe as Aermn, as a body, that one of our key components going forward, aside from actually delivering health services, now for impact knowledge and pass on transferable skills, because that is the only way we create sustainable development in the health sector at any continent. Professor don't tell you say we don't do an across the board. In fact, quite recently, Professor, you might have forgotten that last November the team was in Rwanda. You guys were
Yeah.
invited by the Rwandese government. We may not be able to attend, but we'll go and deliver similar activities in Rwanda and even at the border with Uganda and other places. So this is something that is very much part of the bedrock of what we do as Aermn. And for this specific mission, one of the things we plan to do, we want to really start a conversation around the development of critical care medicine infrastructure in Sierra Leone. We are also very realistic that we not just go on one mission and go say we just pass a magic wand, let there be critical care and there's critical care. No, these things take time. You need to train the personnel. You need to first of all make sure so you get the right human resource capacitation for delivering of this service. Then you can think of what sort of infrastructure do we need to build around this human resource for make sure say we get efficient healthcare service delivery as alone. That not they happen overnight, but if we can start the conversation now and engage the relevant stakeholders and say, this is where we are, this is where we need to be, how do we get there? Then we hang it. Aermn will serve as an important vehicle in collaboration with the Ministry of Health, the university, other stakeholders, the private health sector. So the private sector, how do we join forces together and make sure we not only train these people, we give them the right set of training, we give them the best sort of equipment available, train them how to use them, train the technicians for deal with this equipment, and at the end of the day, we see how best we're able to push the health sector as alone from point A to point B. Already as we speak, we don't make very, very good strides with our partners down there, Ministry of Health and other people. They're not make giant strides in that regard. Really come and see how best we can collaborate with them and push the agenda they forward. So we will having a symposium where we invite lots of professional bodies from across the board, from the junior doctors to junior pharmacists, aspiring doctors and pharmacists, and as well as nurses and other allied health professionals for make we sit down that they get a conversation as to how best we don't identify this as a potential gap as a group, how best can we address this gap going forward. And we'll be delivering similar talks, teaching, similar continuous medical development programs in our host district, which will be Kenema this time around. Professor, I don't know if you want to add anything, if I've missed anything out, sir.
Oh, yeah, well, exactly. So in Kenema also, we will make sure, say, wherever we go, we leave that social legacy of knowledge transfer. And then we also inspire the young one there for, say, if we can live with comfort zone them, for can join them, they also be able to leave their comfort zone and go deeper into the villages to help. That's also the idea. And at the end of the day, every year we also bring some of these professionals to the United Nations in Geneva. We organize a conference for make sure say we meet people from Africa, that South-South collaboration, from other European and the United States, the North and South collaboration, and we discuss the outcome of the things that we will see during the mobile clinics with colleagues there. So at least that will able to make the United Nations pay attention to some of the areas that we don't collaborate with and partner with these other colleagues there for bring more help to the country or continent that they serve. So that's one of the also social legacy they left behind. We not only stop in Sierra Leone, all over the continent, we invite colleagues them as far as India. Last time we get people that come out India, come out Pakistan, come out US, Canada, the Americas, Chile, they all join in at Geneva. And then from Nigeria, from Cameroon, we get an executive of Aermn International coming from different countries. Secretary General from Ghana, Assistant Secretary from Rwanda, maybe the President from Sierra Leone, Vice President from Sierra Leone. We get the PRO from Cameroon. We get the Project Coordinator from Congo DRC. We get the Gender lady from Nigeria. We get the overall consultant from Switzerland, you name it. So we are all coming together with different backgrounds, knowing that we are all defined by a common identity. In most low and middle income countries, we lack the basic necessities. We lack the basic healthcare delivery system. Who the whole hand together will really support every country, especially with Mama Salon. So that's something we do from that little countries initiative.
Okay.
I hope.
Thank you so much. With this diverse membership, and then with limited resources, because again, when I read about UNA, I understand UNA is a non-profit organization. Of course, UNA liaise with the UN and other stuff. But I mean, that don't mean say everything enough for UNA. How UNA can select countries them for go help based on while taking into consideration let's say now the limited resources and all that thing. How UNA they do this selection? Or say, okay, now let's go Salon or Nigeria or this. How UNA they go about it?
Well, we do that in the true proverb, the African proverb say, if you want to go fast, you go alone. If you want to go far, you go as a team. So therefore, if we can't Salon, the Nigerians they come with we run the mobile clinics. We will flip around back to the Nigerians. They say, talk to your Minister of Health. Who say una one local help in your country? If the Ugandans they come with we don't go on a Uganda and Fort Portal. We use the Kenyans they come with we. The other doctor became last year at Salon. The other Nigeria became the Cameroonian. So that's what we do. That's African proverb of working together as a team. So that's what they do because we need the contacts them who know and we need for go complement the Ministry of Health initiative. Every same way for the Zambians, for the Rwandese, for the Congolese. So this is what we all do together. So we are driven by the country need in that bottom-up approach.
Okay, thank you so much. Before anyone ask further question, somebody there in the chat room, I think he name I see Tanzania, and then he say if una go make a ask una for share una website or email address, he says so that then we will get in touch with una for as people away in the diaspora for see how themselves go help or contribute or be part of una.
Yeah, we very much allow that. I think you can share with network the website. Maybe you don't access app. You can type on www.aemrnetwork.ch. And we get members there. We also get a forum hosted by the WHO where we get members from 45 countries around the globe, including Tanzania. And we don't go extensive work with Tanzanians. And Mr. said we don't go Dar es Salaam once, we don't go Zanzibar. And we get lots of colleagues on that forum there. And that's also another area where we use for access countries them where we call we say come and support we like first quarter of 2024 we do Uganda again. Whether a doctor we don't ask to call we say listen we need visibility, we need to come to focus on something like the non-communicable disease. So we come together and work there. So we are willing to go anywhere based on the need, and the cooperation we get from the countries.
Okay, Dr. Kamara. Yeah. Recently, with the Yeri, we know say problem when it comes to health. We know say problem this Salon. in terms of meeting those health needs. And then like would they hear people and they died and say high blood pressure and other half sick them. Una don't ever get the report then there una don't really focus on that for address a particular thing where they hamburg with people them na salon.
Yeah. Thank you very much. That's a very important question. So the thing the way you describe, so we within the medical field can generally group them under an umbrella term we call non-communicable diseases. So non-communicable diseases, it means say a disease where they pass from one person to the other, maybe because you blow something out of your nose or you touch the person and all that one day. It means say there are so many factors where they determine how then disease process then they happen. It can be genetics, it can be environmental, okay, or it can be both. Okay. And it can be so many other aspects there again now in terms of the social determinants of health where they explain why we get that one. And the issues about diabetes, hypertension, high blood pressure, or the sugar sick diabetes, and all that sick then they, just limited to salon. That's something now. These are global issues. These are things where they across the world. And essentially, for we as an organization, one of our key components where Professor mentioned how we want to address this one. Firstly, we do get multiple approaches. One of the first approach where we can use that where we get for good kinema, so we get what we call the mobile clinics. During the course of these mobile clinics, what we do now a two-pronged approach. So in as much as we dey run some small health facilities now the corner dey for see the maybe hypertensive patients and all that, they provide for them person-to-person advice, like direct advice. But we also get what we call the community-based approach when our health education. Okay. So we get health education where we can sensitize these people. What are some of these drivers for non-communicable diseases? How are we able to identify them? Okay. And how do we control some of these drivers? So one of the key drivers we know, for instance, for high blood pressure, for instance, now stress. How best can you manage stress? You understand? What thing again you can do but your diet, like your salt intake, for instance. Or what are some of the things we go eat, we go help for improve your well body one? So we get a health education component where we embedded part of the program. And in fact, when we run with clinic during these missions, one of the things we always do, like when we then we um, clinic consultation with them, for instance, a caring professor, because usually we can always share room next to each other. You go educate, you not only treat the condition, but you go educate them about the condition as well, so that then people then they can go and serve as ambassadors and pass on that information. Maybe then at the head of households, they can inform their households and their households can inform their neighbors. Then we have like a snowball approach for passing that information. We engage the media as well, like what we do right now. So maybe at some point in the future, if we're fortunate to be hosted by you, we can get a whole program where we can just focus on some of these diseases, what are the drivers, and how we can best manage them as well. Yeah, so we provide one-to-one talk with our patients in terms of managing their disease, but we get community-based approaches, providing public health campaigns, educating these people when we go at these mobile clinics. And we generally not go and just go tell them, but we make sure say we work in close collaboration with the people we them already familiar with, the heads of these PHUs, their medical superintendents, their DMOs, they are familiar with them, then are far more effective messengers of health than me or Professor Way come out Geneva or me come out England for go tell them. So we use our local counterparts to serve as the ambassadors of these messages across as well. Because we believe in that sort of approach. We not believe in a top-bottom approach, but we believe in collaborative work. Because we all work in the same vein, irrespective of our localities, which are we fend with self. We all work with one common goal for bring out universal health coverage for everybody in underserved communities.
Okay, thank you so much. Professor Charles Senesi, you get anything for say regarding what Dr. Kamara just said?
Well, I see Dr. Kamara don't really spell it out very well in terms of the interventions there. And I don't get anything more for say, only that at the end of the mobile clinics, the patient card they will get to the anonymously analyze the data. For say high blood pressure at this particular area, we get such a disease process. We use that information and feed that back to the Minister of Health. and then also to our global partners to say, hey, we go to a social place there, social disease was prevalent in high incidence prevalence of, and we'll find out, and because of that, we go bring the attention of the Minister of Health, like doing Uganda and Kenya, and both also Sierra Leone, to say we get some certain high level of this particular disease, of this particular condition. Let we investigate more. Like for instance, most of the patients who they see now only picking them and woman them. The man then they come access the clinics and access the health facility. That's an eye opener. So they share their knowledge and the local healthcare delivery system say, hey, we the man them when they come to hospital and now we are the breadwinners there. What can be done? Let we hold the clinic on Fridays where all man they can at all. Then they're gonna bush because Fridays is free day, or on Sundays where people gonna the most in a town for go church. So those are some of the things that they will send her back to the country where you go and let them plan a better healthcare delivery system for that particular population than they, or that particular disease condition than they. We'll notice that we will pass on to the Minister of Health, when are the custodian of the health of that particular country. So now that's I want the intervention the way for Bill up with Dr. Kamara say.
Okay, thank you so much. Again, I just want to remind Famble them, this is the then and now media empire. And then we get Professor Charles Senesi and then Dr. Mohammed Kamara. They talk to us about issues about health. Today na health they talk about. And the role we then don't they play, like for promote health, and then also for meet the universal health goals, especially under the sustainable development goals. I think this is now one of the goals for the world, not so?
Yes, indeed.
Okay. So based on that, again, Salon, we hear a lot of things, and people in the die as a result of liver cancer or other communicable diseases. Una don't ever like find out, or una can work with the Ministry of Health for know which virus they where they destroy or where they kill Sierra Leoneans them, so that una go for enable una for address or at least for help for try for prevent more killings, because a lot of young people in the die as a result of cancer. Some people in a liver problem, some people in the say hepatitis B, they destroy the community. Then they will not ever think about looking into those areas and for try for help government for address them in the.
Yes, I think you just put the word on my mouth, because during the mobile clinics or the medical missions there, we always bring in specialty that we talk about diabetes, but we also got people who they do the hepatitis B. We make sure that most of the surgical patients that they test for hepatitis B, so that for protect the medical staff, and also for capture some of the cases, and also they do HIV/AIDS tests voluntarily, we cancel their force. But talking about liver diseases, especially hepatitis B, even Aermn with the work with the WHO, infectious disease, because we are also affiliated with WHO, so much so that at least, hepatitis B in particular, don't they cause so much damage, in especially in low and middle income countries, including Salon, and I can say at the global level, at every level we have been not pay much attention to hepatitis B. I talk that as a researcher. I get enough evidence published data that will not be ever pay attention to hepatitis B in low and middle income countries until it don't take away unawares. But the good news is that we use the gains made in HIV/AIDS, because most of the modes of transmission and everything is similar to HIV/AIDS. Not only that, will not be ever focused on hepatitis B, which means now that will not put a lot of focus on it, because the death of the disease morbidity or the death mortality just the rise. We'll therefore put a stop to that, because we don't put a lot of focus on it now on hepatitis B. And indeed, we will begin see in the next couple of years, it will begin decline again globally, as well as real Mama Salon, where lots of people are affected by that particular virus, which they call liver cancer, etc. It is a global call to action, and every country now don't commit to, and especially hepatitis B and C, when are through the blood with the transmitter. A country like Rwanda, we go there with a learn from the experience, they don't almost eliminate hepatitis C, where also they cause liver issues there. But hepatitis B has been a big challenge, because we'll not be paying much attention to it globally until it take away unawares. But believe me, we are on top of the game again, and we'll go crash and down that level there and protect the younger generation, who are the future leaders of tomorrow. So being back in Salone, they do a lot of campaigning, they put a lot of attention and resources on infectious disease, especially hepatitis B and HIV/AIDS and others. So very much committed to that cause there.
Okay, thank you. Before we go to Dr. Kamal, you as a senior researcher, a well-experienced man in that area there, I still they take you to this hepatitis B. Una don't get any medication for somebody because we know say vaccine day for prevent people dem. But now let's say somebody get am. Some people then can get am and the virus can be inactive. According to I don't know well, Mayo Medical no go far. But they say if e inactive, you know can transfer from one person to another. So una get any medication
Yeah,
for help people?
there are medications actually for F manage them, and it may be expensive, but I mean there are medications. But the
Oh,
the major thing would they try for preach initially, despite the high level that would they try for tell people that for that three factors and they in every infectious disease we go make person calm down faster. First of all, your immune system. We try for let people that be health conscious, increase health awareness. Then we will go to all the villages and for increase the health seeking behavior of people for can quick in the hospital. And the second is the how virulence or how bad the virus they, and then the third factor is also the dosage they receive. So therefore, if we do a lot of primary prevention between that virus and that mortar mandate, we actually prevent them enter the body by using, for instance, now mommy and daddy business, some of the hepatitis B that can transfer, we can able to advise on safer sex practices, i.e. use of condom or avoid multiple sexual partners, So they lose a whole lot of other factors for prevent that contact between the disease and the person. The secondary prevention, of course, you don't get the virus now. We get medication could delay or actually eliminate you going down to that full-blown hepatitis disease. And then, of course, see now, I mean, the third level of prevention is that you don't get the disease now. We increase the quality of life with lots of other interventions there. We don't do a lot of webinar there on that, and especially with one other group, salon group where they say, well, body business, well, body na gentry. I don't do a lot of webinar on hepatitis B. We will share on this forum because they're on the YouTube. We don't do a lot of other campaign. Even on the World Hepatitis Day, I can join another team in UK. I bring the whole world, the WHO Regional Office for Africa, WHO Geneva, and other UN partners there. We join Sierra Leone and we talk about the disease and ways that we will help. And we did more research, to be honest, in that one, because we are yet to do a total, we do on now, for see the magnitude of the problem in Salone, for do actually studies, we call it zero prevalence, that big word, but now study inside, take sample them, and now know what's the magnitude of the disease that Salone. That study is well underway by people like Dr. Lako, etc. with the Salone, who always support and welcome come back to the country.
Okay, thank you so much, Professor Charles Senesi. Dr. Kama, you get anything for add there?
No, I think, I think the issue has been, the professor don't adequately address that area there. So I don't think I get much for add in terms of hepatitis B. I think, but just as a quick join out to what the professor say, there are lots of other important advances which take place in the management of this condition. Some of them are still in the research or developmental phase, and so forth. But the primary and the most important step for take right now, as Professor mentioned, are for prevent somebody from getting the disease in the first place, and that will be the primary focus of any intervention we do. But if you don't get the disease, as Professor said, there are other modalities we can able to use for minimize the progression of that disease, for making it become something bad like a cancer, because the cancer they only develop when the individual don't get a chronically untreated disease, and then it can progress. The liver will undergo an irreparable damage to that point, then it will increase the risk for making it cancer. But we want for first of all stop the person from getting the disease in the first place. And just as Professor said, those are all the interventions we don't do at national level, globally, and as an organization, we're ready for partner with most of our collaborators for see how best we can address this as a menace in our society right now.
Okay, thank you so much, Fambulem. Again, I just the remind you, I say, when I watch the then and now media empire. Today we deal with Dr. Charles Senesi, And then we deal with Dr. Kamad, and they tell you about their own contribution to national development. And this is key. This is very important. They work, they touch the lives of ordinary Sierra Leoneans. This not to say na for go give money. No, this na practical thing, na physical thing. And they go to una directly, they don't do operations, ania, na the provinces, na them villages and farms, they don't they touch the lives of Sierra Leoneans them. And I believe say from waiting at the scene at the our comment box, a lot of people in the praise and happy for now. I see again what been they read about Una. I understand say Una dey try for address malaria na the wall, or let's say na this part of the countries that una dey operate, and una talk about technology, how for use technology for fight mosquito and lentil and dey. I even read where una dey use some device wey dey able for wetin say some mosquito. We want for make una explain to Fambule more, and then we want for know whether una don introduce that na Sierra Leone.
Okay, well, malaria na something we some of we for the past 19 to 20 years will not ever experience that again because of the country we live in. But notwithstanding, I can tell you say one of the worst experiences anybody can get malaria in the country. It's so horrible, you feel hot and cold. So even we've not been in the country, we partner with other institutions there, we partner with other scientists for say how we will think out of the box. Because I may not be part of the rollback malaria, board member, and we realized say for donkey years we just use mosquito nets, insecticide treated nets, but at the global level there has not been any, and now we don't make good advances with vaccines, but then we needed something that will actually target the parasite before ever develop into the full-blown mosquito. So then we could come up with these scientists within the US, some callers, we developed something we call Provector, when are just a small pesticide who they use for purified water. But that particular chemical, say they call them BT, big name Bacillus thuringiensis. It actually, with the mosquito ingest them, it actually enter the gut of the mosquito and twist that gut there, and then the mosquito are not able to survive again for throw out the malaria parasite into the human being. And when it die, they also give out that chemical in the water where they around her. And the larvae of the mosquito, they all die. So now called a Provector, where we don't develop for many years, we get a lot of video there. So they support some innovative ideas that in controlling the mosquito population, indeed will be those rollback malaria, and then we introduce an salon over the years, but it takes a while for it actually get full effect. So we don't do lots of research on that in Kenya, in Nigeria registered, in the US, in different parts of the state, because they said it suffer from malaria. So indeed, we also we support innovation, harmless innovation like that with the chemical now they use of purified water, but it toxic to the larva or to the adult mosquito itself. So now that will be from 2009. We did a lot of conference in Amsterdam on malaria control. We introduced them, the CNN, of course, Aisha said we promote a whole lot. And we are looking for young scientists, young researchers to take on issues of harmless issues that can control certain infectious agents that affect the communities who they live in low and middle income countries, including Salon. So now that's then our website, then on YouTube, on Provector. We don't even do other advanced formula, as the professor said, but it's all harmless substances. Nothing about genetic modified organisms.
Okay, yeah. Thank you so much, Professor. So again, still because at the pinuna down to Sierra Leone. Like I really want to know, because say malaria malaria now that big problem in our country. Whether una really don't put this thing into trial na Sierra Leone. Now that's I want for no particular.
Well, the tale will begin unfortunately then the Ebola come.
Okay.
So after that, now we struggle with the Ebola, we're done. We get before they stand again, Corona come. So we'll not be able to get due to natural cause of events. We're not able to do that wide scale testing we want for do really. We just get preliminary data like Kenya, a small one as Salon. But now that by God's grace things don't stabilize, we get for reach out to the scientists and again. And then we come for launch afresh like we do in Zambia, also in Salon afresh, because we are such a small country. We can get really good impact factor. So definitely those are our plans. Professor Collars, I try for encourage for Kai again. And indeed, 2 days ago, he writes me. By God's grace, me set up be permanent as salon now. So most of those my colleagues will come back now and help, in some of the innovation that we'll be able to do harmless one day, so that at least we will save with population.
Okay. Again, so far, Usauna don't test them. How effective it is?
We did a publication in Kenya. The first publication was in Kenya. It was very effective, and then we did preliminary in Salone, but they're not in large scale. And then we registered in Nigeria. But the Kenya studies was very, 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 very eye-opening. We also do an Cameroon as well. We analyze the data. So it's quite effective in controlling malaria parasite actually, which is very, very good, because most instances, most of the bites they get outside up and about in the evening hours. So if we reduce the population of the mosquitoes significantly, definitely we will achieve a whole lot. But luckily now we don't get the new vaccines against malaria, which is being tested. I think Sierra Leone don't get some doses, well, as I will read before I come relocate back. So there are lots of innovations they work on.
Okay, thank you so much. Dr. Kama, you get anything for add in that regard?
No, I think it's been eloquently dealt with by Professor. As you say, we when it comes to managing communicable or infectious disease, then as you say, there are multiple approaches, and one of them in our within Professor will describe so now like the vector control, dealing with the mosquito way in they actually transmit the parasite which cause the malaria. Okay, and the other component we can try for look at as well now for actually see how best we're able for give the people then sort of immunity, okay, boost the immune system in such a way that the parasite will get that kind of deleterious effect, that kind of bad effect on the body, right? We're now through the vaccines, way for we in novel development. It's something we are very excited about, and I mean the thing about the scientific world in terms of research and design is an evolutionary process. It's always evolving. There's always something new. There's always something new on the horizon. So, for all you know, this might have been tested in 2009. There are lots of other things really go on at the background. So it's just about sometimes you just need for dip your toe into the ocean, then you see a whole lot of stuff. They show up at you. So in terms of research, I mean, I think there are lots of quite recently again. I think just from that pro-vector standpoint, I was watching a YouTube video, Professor. I think of it was I think it's somewhere in Kenya as well, where in these guys are people that or Kenya or no, it's Rwanda actually. It's in Rwanda. So actually they're using this drone technology, right?
Mm-hmm.
When they do some sort of chemical, I'm not really fully familiar with them. I'll not be keeping that up with me. But this is like a drone technology, you understand? Where they go, they identify, they use like some sort of infographics to identify the area of high vector burden in Rwanda, use drones and actually target those areas and prevent further replication of the parasite. So there are so many innovative research and design where they go into these conditions that, as we say, we just need to get that sort of support, get the enabling environment. And as Professor don't say, in this alone now, in this alone for see how best even for contributes to the development of the health sector over there. With people like and with the support of all the other relevant authorities, we believe say if we dip with two into that ocean, so many things will spring up we able for use, okay, and see how best we can address this menace because malaria is one of the key killers of under 5 that we can't keep, and
Okay.
it's something we can manage and we should do something
Okay.
about it.
Okay, thank you so much, Dr. Kama. And still, I want to remind Famble them, say in the watch the then and now media empire. Professor, I see also wanna create a future global diaspora and policy alliance. What in this day for?
Oh yes, well, as one of the Akola ambassadors for IUM, the International Organization for Migration, we done struggle a lot with different diaspora groups. You get all the country-specific diaspora groups. We get topic-specific diaspora groups. So then the IUM, together with the other countries in Europe, come with the idea, say, why don't you create an alliance? Like similar to what Aermn do, that we have professionals who are supporting health. If you're an engineer, you able to build that bridge, we go make we run with mobile clinic faster, you have contributed to health. So they say, why don't you create an alliance of different players and actors in the diaspora, working on different technical working group in health, in engineering, in policy, etc. So that the IUM be launched, lots of countries then signing on them, and even with which are proud for me is Sierra Leone, is that now the only country that will get office of the diaspora for health workers in the Ministry of Health at the policy level. So that global policy alliance will also, learn from the experience of Salone. Me na one of the only diaspora where they be choose from the NGO sector for can present at that alliance day as the launching of it in Geneva a couple of months ago. So with that, we hosted different technical working groups don't be already be identified. We will contribute to the alliances instead of country specific. We'll now talk about health specific alliances. And the mission to Sierra Leone by the IUF is also one of the very first we could call and putting boots on the ground, sending physical doctors really as a big team for about 6 weeks, and more, and learn from that particular group there. So there are building a lot of we work in Sierra Leone at the global level for building this alliance. If we could replicate what we do in Salon, so to Rwanda, to other countries, they will go into as a big team. It will be a big impact factor. They could be doing we will do in November to Rwanda and Congo. So I think that's the essence of that alliance, the way they form now. It just at the preliminary stage where they build upon existing successes what we don't get. They're from real network, which is really create a lot of impact on the global stage. Up to the UN level, starting from that small village level. So that's the essence of that alliance. More will be evolved in the coming months, but it's really going to be very powerful alliance in terms of bringing all those country-specific diaspora organizations under one umbrella and talking about thematic areas.
Okay, thank you so much. Professor, I still dey hold you because, of course, we don't see na the flyer. You na Deputy Minister of Health one. So we want to know because with all this, you vast knowledge, you experience, whose improvement una don bring na the ministry? Wetin you feel say Sierra Leoneans they go benefit out of your skills, your knowledge, and your experience, and your vast connection we get around the world?
Well, thank you. Just give me CV. In terms of experience and vast knowledge, we as sure say I don't bring to every low and middle income country in Africa. Now is the time for their back to Salone. So that I can say if you want to move far, you go as a team. So I hope see all the countries that we don't help in the past for the past 20 years or more in the diaspora. Now that some of them come back home, indeed they are coming back and joining us to build Salone because we're only 7.5 million people, small country, short impact factor, a lot of things we do in a Salone. I can only tell the international community, say, smaller countries, quick impact factor, quick turnaround, you can use that for scale up to other countries. And we are really getting a very wonderful team hold on it. Of course, I don't come for the past 6 or 7 years. So based on that, I think we get a lot of added value to bring to the healthcare delivery system of Salone, upon which we could stand upon that and advocate for the most of Africa. Remember, I say we are one of the Athens of West Africa. So Salone will get a track record. If he works in Sierra Leone, believe me, he can work in many places because we are unique in so many perspectives.
Okay, Professor, also, we plant here say, well, people and they nurses them, I think they not get pin code and other thing there. So you don't really like focus because since you the focus for develop that level day na the health service or wetin say una don look into anything and dey for help them people and they so that they go fully come on board for deliver the service we needed.
In the area of human resource for health, I think say I've been one of the people that were very passionate about not only for Salone. If at the level of the WHO, being among the 20 people that would take a think tankers for look for solutions for the acute shortage of health workers across the globe, especially in low and middle income countries, including Sierra Leone. So based on that experience, I think I will pull a lot from there also to bring a lot of attention and experience in what is going on in your country of origin.
Okay. Una, thank you so much. We'll not get much time. Maybe we'll just get maybe 5 or so minutes. But one go na the comment box. Some people then talk, just ask question or make comments so that una say yeri. But I just dey bring few. One Lamin Denke say una open up the health sector for giving scholarships to junior doctors to specialize on key areas. So I want una go address that later. Make what done. One Roland J. Calon say it is. He said this is an awesome venture. As the head of mission Sierra Leone, I would love to make some input. I don't know what you mean now, whether you want make input now, yeah, or maybe you want contact now for help there. I'm not too sure what you mean by that. One Mr. Bilo Njai Jalo say, tell Dr. Kamara say Step K miss him so bad. He was our source of reliable information during Ebola. Again, Lamin Denke also continue for say, if couples get hepatitis B already, can they still get sex without condom? So I don't know whether I wanna get something for Rob along then comment here. What I read for now.
Well, I take the last one. I already been not talk about that one. They say for a particular virus where you get, for you come down faster with the disease depend on one the dose where you get. So if now two don't get a definite and different levels of the virus in our system, so the best you can do, and the longer you stay without increasing your viral load, the better the prognosis for you at times. So if even if you're too positive, now you use protective sex, at least that will reduce the viral load, that will reduce the sharing of the virus to between or to just similar to HIV. So indeed, continue for use with a protective sex so that at least the body itself tend to reduce, fight back the virus. So if your dose is small, possible say the body will really fight and develop with a good immune system, which are one of the three factors the way I talk about, then they can overcome. So therefore, it's best to use a protective.
Okay, so Professor, before that holiday, so it's possible for let somebody get up, but then the immune system, if it's very good, able for fight the virus and clear an eye system.
In fact, according to research, let's take even like some of the worst virus system like HIV/AIDS. Research just shows that if you are negative, you get unprotected sex with somebody, the chance for that you will get an 0.003% because or 0.1%, because if you that first attempt, you get a robust immune system and they clear the virus. But if you make transcarriers, you go again, then you don't already weaken your immune system, the ability for clear the virus. If you go again third time, that makes sense. The more you go there, the more you drink, the more you increase the toxicity that your body. So indeed, so similar so for most virus system, maybe one go, just a tiny piece of virus, robust immune system, you can actually clear some of the virus at that one go. But if you go on and on and on again, then past marketing not good.
But what about now if married man and married woman, how they want born picking but then get up? But they talk about protected sex. So how that they go work? How picking go come?
The best will be, what you know for doing from act like the best will go see your doctor.
Yes.
Okay.
Yes. Because otherwise, don't say that some doctors in the CBC go see. And nobody cares. Every case they're different, So I don't do a lot of presentation on it. We don't have to go that. It takes a whole hour. Now not give some standard information.
Ale, then I now be the clinic now already.
We don't mind, but at least we can say, come see your doctor. Go explain fully what are the implication of not give half information now you take them as a gospel truth. No. Okay, well, I don't know what doctor will foresee.
Yeah, Dr. Kama, you get anything for add day?
Yeah, no, absolutely. I think I was just going to interject there where Professor just realized So definitely the right approach stand if you get any medically specific question you get the right person to talk to your doctor and not Lawande, because there are a lot of nuanced explanation about some of these things, as Professor don't say, and we in a platform like this, people can be misconstrued and we don't want to pass on. The last thing we want to do as an organization are for send anything there which might be misconstrued as otherwise. But the right thing to do, talk to your doctor, it will give you the right set of advice, because there are patient-specific factors that we have to look into when we make clinical decision. Most clinical decisions are based on judgment, and this judgment is based on the information we obtain and within the circumstance where they are around the patient. So until we know more about then specific circumstance than they, and all that one day, then we can provide personal advice to them as doctor, patient.
Okay.
Yeah.
Okay, thank you so
So,
much.
yes.
We'll not get much time again, but I just want to ask maybe second to last question. Let's say una organization, like somebody talk about giving scholarship to doctors them so that they will specialize. In una introduction, una don't talk about somebody who una get for support for come study. So una can look into the area then they back whether for give scholarship to people doctors then or maybe una they pick up una they see star so una want for make develop am but you know get at least that personal capacity for come empower himself or government you know get that sababu dey again. Una can do them thing again for help Sierra Leoneans them we want for go empower themselves.
Well, we don't do in other countries. For instance, in Kenya, we get the bursary system, wherein we look at needy students, and we get some donors like Maya Glickman, when one of the deputy head of national health statistics in the UK. We identify the poor people within there and pay for them through institutions so that they can go back and serve the community. And what I be saying also, we will bring in some of these specialists or other colleagues in a low and middle income countries, including Sierra Leone, when they create a bond, they see your vision. Like I tell everybody, nurse also who seen in Moyamba, he's so hardworking that one of the colleagues that don't get a scholarship for fulfill in the dream of becoming a dentist. So as I talk now, they left for Cyprus in the next 1 week for go to pursue dentistry. And we done, we hope to come back and serve the country because dentistry is underserved area now with country. So on that same vein, they meant a lot of people that would they out to get access to lots of information like with the network, also like Mohammed, like me, would they show us some of the information we go use for access scholarship. We may not be able to give you full scholarship, but we know how to act as a reference, as a network, to say this is a needy student. I could write a reference letter for you, maybe so we are really credible with enough evidence. They listen to a lot of us where we recommend people. So we act as a sort of reference for you to stand upon and achieve it game. And if the sponsor they get back to we always pick, support. And indeed, it has worked in many areas, many Sierra Leoneans. Every now and then they write reference letters, support them in their postgraduate, in their knowledge seeking behavior. If I get the donor, if I get the scholar call for scholarship, with the announcer at the forum and follow up with letters of recommendation. That has worked over the years, not only for Salone, but different parts of the world. Then we are also affiliated with universities, which are also doing postgraduate studies. Most of where I study are also a whole other one that they hand them. At least let them access the knowledge. We get for go through a lot of difficulty for access. But since I don't make the pathway now, with the whole company they handle like Mohammed and others, they now in passing exams, in access to scholarship, etc. So yes, we do a lot in human capacity development.
Okay, thank you so much. And also, Professor, what you they do for empower and for capacitate the public health sector in Sierra Leone?
We afford, we country the custodian of the health of Salone from the government side in terms of resources, human, material, and financial, and also from the private, public partnership side. So it's great. It's a multi-pronged approach, and also working with the custodian of the health of the world, the WHO, and the United Nations, so that at least whatever we are doing in Salone, it rhyme with what we do. So that now some of the experience that we some of they bring back. Because we come up from the UN to the WHO, Geneva, WHO, AFO in Africa, come down to Sierra Leone, get the necessary thing them, and float them back to the global world. So with that, we bring a lot of added value to the country.
Okay, thank you so much. Dr. Kama, before you left what you go left with we? Now this platform and the one that we watch you.
Okay. Well, I think firstly, I go want for tell you plenty thank you for where you provide me this platform, this medium for make we able for communicate our activities over the years and some of our the mission, the proposed mission we get in Kenema and as well as our vision going forward as an organization. We want to thank all the people that we don't listen to this net. We don't want to thank on for our comments there and all. And just want to respond quickly to a colleague we just Roland John Calon. So yes, he's also a medical doctor. He's a phenomenon within this organization. So he's actually the local head of everything we do operate in Sierra Leone. So he's the one pulling the strings down there as well. And I see in your comments as well. So we appreciate everybody we come on board today. I think for me, the take home message for me specifically, that no dream, no dream in this world, to understand, is too big for one to achieve. All it takes passion, it takes drive, it takes you being with the right people, get the right sort of network, interact with the right sort of people, and then with a bit of hard work and some element of luck, you will get there. So one of the things we me very, very, very passionate about, and we at the learn from professor and the other senior colleagues about interact with, now that no amount of knowledge or exposure you get, okay, will be super useful if you not create an enabling environment and platform wherein others can equally gain access, okay, and better than lives, better than communities, and better society at large. So we as Amren, we believe in leaving no one behind. When we say leave no one behind, we mean in terms of patients, we mean also in terms of colleagues. For those of us who've been fortunate, today, we have a moral responsibility and focus for ensure say the generations where they come after we, despite we don't struggles we don't get, we pave the way for them as best as possible. But but the key thing is they have to dream and dream big, put in the work, because Rome was not built in a day. Professor not become professor overnight. It takes a lot of toiling and toiling and toiling. It takes a lot of no's, lots of knocking on doors with no's. But there was persistence, there was perseverance, and a day like this, if any so I can give similar testimonies about my experiences for getting myself started like today. At that day, we decide for pass on to the colleagues as well. We not only want for pass on knowledge, but want for inspire the next generation of health leaders so that then we even surpass professor, surpass whatever person they can be able to achieve in a short medical career. So that will be key take home message. As a Sierra Leonean out there, no amount of help too small. The organization we not get money. It's purely voluntary. Now we take time off out of the annual leave for good on day for go work. We not get any loose cash with the flow around. In fact, when we go there sometimes, professor will attest to the fact say sometimes we live there relatively dry because we have to go the extra mile. Look, taking into our personal funds for ensure say certain activities are actually implemented for our people. And we come back home with pretty much nothing. But that is in terms of financial benefit, but we left there with our hearts filled with joy, with peace, knowing we don't join forces with our colleagues back home in making a difference in the lives of even one person. That joy day, it keep we going, it keep we energized for our subsequent
Yeah,
missions.
but just imagine before you dey go, just imagine somebody get that big something
Yeah.
wey na hernia. So
Mm.
now go put that dey for that person. That joy dey wey una dey left. It's very good. Like we now for touch that you don't touch the life of that person. So that kind changes, that kind impact dey now una dey create.
Yes, a classic case in point. Sorry, I'm not meant for cut you off. Professor will attest to this. I think the last time we were in Banff, Professor, there was a patient who gets similar something like that, a very, 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 very large one. We don't get them for years. Very, very chronic. It was otherwise relatively young man. Then they don't affect them personally, right? It don't affect in relationship with his wife. It don't affect in ability for able to provide the basic needs for in picking them. It don't affect in level of confidence in community for interact with in fellow men. And through Aermn and in partnership with the DMOs and other partners at Banff District, when we do that surgery, you don't want to see that man. It was a spectacle to behold. And for
Mhm.
me, Dandy left an indelible imprint on my mind and also that of Professor. Yes, you can see I'm smiling talking about it because for me, that an image will deal with me for the rest of my life. Thinking we just provide a small platform, we make that Monday in life don't change for good, and then they trickle down to in picking them in community. And that is what we do at Aermn. We leave no one behind. We bring everybody on board. We feel say all of us, including our patients, we're all partners in development. If we join hands together and we work hard with the vision of people like Professor Senesi, I think the world will always be a better place. Thank you.
Thank you so much, Dr. Kamana. A very touching thing. This, Professor Charles, you have the floor.
Oh, when you see my second in command, Leon, so well, I think not much to add, but only to say that we are never small to make a change. That's the essence, that you keep pushing. At times you don't know where you are going, but you are on the way. And indeed, we don't touch so many lives. I mean, I can relate to also the other patient who was ready for amputation in Kamakwe. Oh, Mitam. He gets a road traffic accident with Okada. It was done for amputation. I mean, there was no way. They can't afford the surgery. They're not getting facility. Those are some of the cases who can't operate locally. They pull a can of Freeton, put in a private clinic. Not the money we get, but we relate to that young man, say, if we bring and come back to life, today, that man is walking, and each time you see him, you can't imagine the joy where you see Musa pull from. And those are some of, not only physically what they do there, but the lives of the impact, the picking how they operate upon, when they come back. In Kenya, one operate on them, they can't a year later with a granite, one chicken. It's in that's the one can't tell we thank you for. So it's a whole thing, the way people are thankful in the African continent, in Sierra Leone. I can reach out to people that say, as a last word, I mean, you can have the choice of joining us or creating something similar. We can allow you for leave your comfort zone and come down to low and middle income countries, Sierra Leone, and come down to help. That joy of helping, that you will never ever, no matter how much money you get in the West, you will never get that joy. Come and feel it and test it, support the cause. If you cannot come physically, or if you can, the better come down and join us, so that at least we can make the better salon.
Professor Borden will ask you whether the environment is conducive for
there's nothing like 100% conducive environment. And then, but it's how you make it. You come with a low expectation, determined to effect a change. You can do it. You can do it. There's no other possible for can make salon other than we come from there. They say the best pilot from here to the flight to UK and back is somebody we know the road. The best driver between Bo and Kennyman and Wama, we don't drive the plenty, sabi all the curve there. So you wake up to GPS, where he fail you, they go and ditch. But that man, they hold one hand, they pass the road. So therefore, for we the Sierra Leoneans in the diaspora, back home, let we live with comfort zone them and go out and help people there. You will never know the impact we create if we all hold hands together. That's what we said. If we want to go far, let's go together. Let's all never go alone. It's a proverb that is all over written in Rwanda. It takes two to dance a tango. So therefore, let we come together for help with Comfy Salon, put all the differences aside. We share the same identity. So let's come together for help with healthcare delivery system. Health is not only limited to doctors and nurses. If you can't build factory, you can't do anything in your country. There will be challenges at the start, but challenges are meant to be overcome. We will help you to overcome them. Those of us who have done the sacrifice of going back home. Mohammed, he cannot wait to finish his specialty. He's all set. That's what is his mindset. So where you come and go, you enable you to take that giant step for come and relocate back home. That's what we can advise people then. Not just pack your bundle overnight and can Africa. Can't test the water, you go back, look the gaps, get the feel of it. When you get it for camp now, the culture shock will not be great. 20 years I've been away, but I was able to march into the society because they come back and forth, can't help and go. I know every nook and corner of that country, east, west, south or so, because don't the work clinics are everywhere.
But some people like in fear say, well, we salon people so man, well, we don't deny, we don't used to that honesty and all that thing. But if you go into business with some of people you'll be disappointed because most of them then yes and no mean, but we not understand that.
In every society you have the bad guys, you have the good guys. Even the best of the country go with it. I mean, if you're based in the UK, I mean, somebody must swindle you. You have to be smart. You have to be sharp. And it's a matter of give and take. People, I mean, every continent, I work all over Africa. You can never say every country you got bad guys and good guys all over the world. But that should not stop you for going out. You know, try and fail is no disgrace. You might, but along the way you find good people. Like I've been able to assemble my team just by looking for them and grab today. I get an enormous team all around the globe of good people. There are bad guys as well. So that's not for stop you. You know, always go with an open mind, you know, and there are good people all over this place. Like what the Desiderata can say, you know, don't compare yourself with others. They are all greater and lesser person than yourself, you know. So now that I'm your policy, they know me. I go to open mind. We have been cheated, not only in Sierra Leone, all over Africa. You will bang, but at the end of the day, the one day we not get nothing for do with this situation. We need to help. Those are our focus. When they're gonna do all kinds of things to you, that smile, that little thing, where they do, and that will make you yes, you can continue with the passion. Put your at least your resources where your passion lies. You know, it's never perfect. Nowhere in Africa they talk with experience. All over Africa, I don't work run the clinics, you know. But at the end of the day, the bottom line is that you always have joy in what you are doing. Don't have fear. You never try, you never know.
Okay, thank you so much. Don't have fear. You never try, you never know. That are the exact words of Professor Charles Senesi. And this professor, na ina the Deputy Minister of Health 1 of the Republic of Sierra Leone. So una know that day, and these are the last words we left una with. Again, una well professional doctors and anybody we want for help Sierra Leone or make Sierra Leone go before for make we achieve we universal health care goals. So una go back. The professor did there, he didn't the ministry. I believe say go give una the right guidance. So now so we dey left una for today from the England, and then this na the then and now media empire. So una thank you so much, Professor, and thank you so much, Dr. Mohamed Kamara. So until then, we go hopefully we will bring una after we una don't come out from that visit for Kenema and other things. We get for follow up. We get for we bring una often at this platform. We make una engage with Sierra Leoneans. But until then, this na Cycle John Barry. They say goodbye and good night.